the summer of last year, we were just starting to get prepared for the Moderna vaccine study. So we didn't have any vaccines. We didn't know if any of them were going to work, but yet we all just sort of rose to the occasion and went full force ahead. There's no doubt in my mind that the success of these vaccines and all the work that went into it and the trials, which, we needed to show that they worked and were safe, have saved, hundreds of thousands, if not millions of lives.
Actually, it's quite remarkable. We've given out almost 500,000 doses. It's 483,000 doses of vaccine have been given out across North Carolina by UNC Health.
I cannot begin to express how grateful I am and how good I feel about working at UNC when I saw how people mobilized to provide the vaccines at UNC.
We're trying to help people understand more about how they can protect themselves. Really, this is a tough time right now on this anniversary. We're going through another surge. We have a new variant that's come on the scene. So we're not done and we're not in the home stretch. And we need people in North Carolina to help us out by getting vaccinated, by protecting themselves and their loved ones, by masking and following really pragmatic, common sense rules about how to prevent themselves from getting what is clearly not just a cold. This is a very serious infection.
The vaccines are, just so important. I just wish I knew the magic things to say to make people understand that and that really it's out of our concern for them and their communities and everybody that they love. The boosters just increase that protection.
We have now infusion centers across the state that provides monoclonal antibodies. Our emergency rooms are also involved. And then of course, the excellent inpatient care. We have a skilled team of people in hospitals across the state who can provide intensive care for people with COVID-19, which is no easy feat. It's a very challenging disease. So I think we've done a tremendous effort. At the same time, we really have tried to reach out, make sure that we reach all types of people from all walks of life.
So I am just grateful to everyone who works at UNC. I'm so grateful to all of the physicians and anyone who had to walk into the ICU during these really dark times, and the hospitalists and all the folks on the floors where they were taking care of patients with COVID. I have a sense of how hard they worked and grace under pressure.
Whether it be a nursing student or a PA student who's volunteered to give vaccines and has been at it for weeks. And, the people in the ICU who I see every time I'm there, the same respiratory therapists, the same attendings, the same fellows, the same nurses, and they're there all the time, day in and day out, caring for people who are really, really, really sick. It's just amazing. You just can't name them all, from the people who do, the checking in, the volunteers, it goes from across the board, the people who have cleaned the rooms and the food service people. UNC Health has had a major part, undeniably, unassailably, in the COVID-19 response here in North Carolina. It's just been tremendous, and we'll continue to do it.